I've been asked to cover NEAT and exercise, including yoga for obesity and NAFLD. And this is the brief outline of my talk. I'll mainly be making 4 points. First, that exercise is effective in management of obesity and NAFLD. Second, the role of NEAT in obesity and NAFLD. Third, the role of yoga in management and obesity, management of obesity and NAFLD. And finally, how to motivate the patient for a behavioral change so that he exercises more. Now, obesity and NAFLD have become a nightmare for the health planners. Firstly, because they've become a public health emergency. Nearly half the world is either obese or having NAFLD. And second is, it is predicting an economic crisis in the world. And therefore, I'd like to begin with a key message from a very tiny friend of ours. This is a ruby-throated hummingbird who migrates from South America to North America every spring. And before her migration, she eats voraciously and gains almost 100% of weight what she has. And she becomes obese and develops non-alcoholic fatty liver disease. All this weight she loses in one single flight of 500 miles. The message she gives us is that both obesity and NAFLD can be cured if we exercise enough. Now, most people view obesity and NAFLD as the same disease. It's actually not the same. As far as the exercise is concerned, I'd like you to focus on the last line. Diet and NEAT are important in treatment of obesity, while exercise has a supportive role. On the other hand, for NAFLD, exercise benefits irrespective of weight loss, proportion to the time and intensity of exercise, and it is as important as diet and NEAT. So dieting is more important than exercise for obesity. I think my colleague Ashish has also said the same thing. Zipping your mouth is more important than exercising in obesity. For example, we are recommended 10,000 steps a day, and you can overcome the 10,000 steps with one just chota coke. Dr. Ramesh Rai, you just had that candy on the table. You'll have to climb 4 flights of stairs to spend that much of calories. Running 5 kilometers will burn off only one donut. So the amount of calories we burn with exercise is very small. Human body quickly learns to conserve energy despite exercise, and the weight loss cannot be sustained. On the other hand, exercise is as important as diet, if not more, for NAFLD, and it helps even if there is no weight loss. Now, lack of exercise is a major cause of NAFLD. This is something which has been proven in various studies over and over. I'll just quote one study, the last one, that is hepatic fat increase by 1.15% with each additional hour of sedentary time per day. That means sit in front of TV and you are gaining weight, gaining NAFLD in any case. There is a strong relationship between the skeletal muscle mass and the non-alcoholic fatty liver disease. It has been shown that people who are sarcopenic, they not only have higher incidence of non-alcoholic fatty liver disease, but also high incidence of fibrosis due to it. NASH resolution can occur in nearly all the patients with enough exercise and dieting. 10 and 16% respectively will lose their NAFLD if there is a less than 5% weight loss. But more than 90% will lose NAFLD if the weight loss is more than 10%. And weight loss is usually achieved by diet and exercise. A systematic review of 24 exercise-only studies in NAFLD have shown that exercise led to 20 to 30% relative reduction in hepatic steatosis. It is independent of weight loss. Even if the patients did not lose weight, the NAFLD did improve. And it was shown that different type of exercises like aerobic and cardio exercises or resistance or strength exercise training or high-intensity interval training have similar effect on liver fat. Any type of exercise you can choose. Therefore, patient may choose any type of exercise that their comorbid conditions will permit. So, people who have osteoarthritis of knee, they can choose exercise of the hand. Even this stress busters kept on your table is a good exercise for the hand. Now let's come to the new kid on the block, that is non-exercise activity thermogenesis, or NEAT. We all exercise only for about half an hour to 1 hour in a day, but majority of time we are spending fair amount of calories, and it is our environment, genetic background, and individual factors like race and gender which determine how much of calories we spend in NEAT. And studies have shown that a very significant amount of calories are being spent with NEAT. And the importance of NEAT is the fact that we'll exercise only 4% of time of the day, while NEAT will be spending energies up to 63% time of the day. So one recommends active living. For example, they say you park your car 1 block before your destination and walk the remaining distance. Take stairs rather than lift. Give your maid a weekly off and do that work at least on Sundays. Office work, you should do standing rather than sitting down, although the patients will feel a little apprehensive if you are standing and examining them most of the time and interviewing them. Disco every evening, otherwise you can dance in the shower, that should be good enough. And it aid to weight loss is very well established. Though logically it should work, no specific studies have been done on effect of NEAT on NAFLD. Studies have shown that with active living, you can double the amount of energy you are spending every day with the NEAT activities. And a lot of studies have started appearing in literature, and they are promising something which is almost magical. You can cut down on your BMI within 12 weeks to nearly half. Weight loss benefit accrual for NAFLD is logical with the weight loss that occurs in obesity, but we do not really know how much it will benefit NAFLD. Let's look at the age-old wine that we have, that is yoga for obesity and NAFLD. The problem here is that most of us view yoga as only exercises. It's not really so. Ashtanga yoga, which was promoted by Patanjali, has 8 steps. And if you look at the first few steps only, that is self-control, discipline, physical exercise, pranayama exercises, if you follow just these 4 or 5 steps in the beginning, I am 100% sure that neither obesity will develop nor NAFLD will develop. However, most of the studies have focused on yoga exercises, and some studies have appeared. They have shown good results, both in reducing the body fat measurement, BMI, as well as increase in the skeletal muscle mass, which seems to be too good to be true within 12 weeks' time. Most of these studies which have shown benefit in obesity due to exercises have appeared in very obscure journals and are technically very poor studies. Unfortunately, robust studies are not available. Even studies regarding NAFLD have also appeared in very obscure journals, and they have been very poorly conducted studies. Better studies are required, and that is a requirement that we have. So I'll summarize the effect of yoga and NAFLD. Yoga practices include all scientific preventive advice that we give for the obesity and NAFLD. They are highly acceptable to Indians, not expensive at all, likely to be highly effective. Effects of yoga exercises alone, scientific evidence is very scanty, poor in quality, and we need robust evidence. This is a gap in our knowledge. Last point, how to motivate people to exercise. I know my time is finishing. I just have half or 1 minute only left. There have been motivational interviewing as evidence-based collaborative communication style that aims to strengthen a person's motivation for commitment to change. Now, this type of interviewing can be done at an individual level by a doctor. So you set the SMART goals for the patient, look for barrier identification, why he can't carry it out, take out a coping plan, and suggest self-monitoring progress. For example, wearable watches are available everywhere these days, but this is just one of the factors that can work. What we really need is the society has to rise to the occasion and take the responsibility of managing obesity, which has now become a public health problem. So we need to look at the urban planning with having playgrounds for the schools, walkability, the gym availability next door. Fast food conveniences can be made inconvenient, and incentives and disincentives should be given for weight loss in obese people. Apart from that, if you look at the political will, it is lacking in most of the countries. But since the time is running out, I'll just mention that inclusion of NAFLD into NPCDCS is an important landmark for India, and we are moving in the right direction. I'll conclude by saying that NEAT, yoga, and aerobic exercises are very effective treatment for NAFLD as well as obesity, as it physiologically hits at the root cause by expending more energy. A difficult problem is to motivate people to how to regularly exercise. Healthcare industry must upscale its act to seriously attempt to motivate people to adopt the lifestyle changes. And if society and nation takes it up as a challenge, no drug may be needed for majority of cases. Thank you very much.
Thank you, Dr. Anand.